All right, we have a pen and we're ready to go. My name is Meg Graham, and I'm going to talk to you about joint disorders and lifespan changes today, so let's get started. The first thing I want to do is X out this definition that you have right there, because that's a little bit too encompassing, so I want to break it down a little bit more. You have sprains, which are going to be injuries to your ligaments, and then you have something known as strains, and strains are going to be injuries to your tendons or muscles. So don't get those two confused. They both result in the same thing. You're going to have swelling, pain. They both pretty much have the same type of treatment, which is this therapy right here, which we have listed here is called RICE, which means rest, use ice, use compression like wrap and ACE bandages, things like that, and then of course elevation. Get the injured joint above the heart is usually the best way to do it, just to help with the swelling and getting the fluid drained off. People often think, oh, well, I only sprained my ankle, and you think that's good. Well, you probably would have been better off to break your ankle because your bone is very vascularized and heals a lot quicker than ligaments and tendons. So sometimes sprains are harder and strains are harder to heal from than broken bones. But you think, oh, well, it's not as bad because I didn't break it. But that's not always the case. But just remember the therapy is the same, that RICE therapy. We have a joke with one of the trainers at the school where my kids go to school in high school. And it's like you could go up to Brad and say, hey, you know, man, I hurt my elbow. Oh, just do the RICE, ice compression, whatever. And then we could also say, Brad, I cut my arm off. It's bleeding. What do I do? Oh, just do the RICE. But we know that's not going to always work. All right, well, let's move on here. All right, another problem that you may have with your joints is called bursitis, and that is inflammation of the bursa. And a bursa is just a little oil-filled bag, and it allows joints, the muscles and the tendons to just kind of roll over this or glide over this oil-filled bag, and it provides a frictionless surface. You end up having increased risk of bursitis or inflammation of the bursa if you do repetitive type work. There's a thing called housemaid knees. Well, what's a housemaid going to do? She's going to get down on her hands and knees and scrub the floor. And so her prepatellar bursa, or that bursa around the knee, just gets agitated and irritated and inflamed, and that causes all kinds of problems. You're also going to have a increased risk of getting bursitis as you age. Basically, everything wears out as you age, and this is just one of those other things. The treatment for this is, again, rest and ice. That's pretty much going to be standard. And then we have written down here NSAIDs, or non-steroidal anti-inflammatory drugs, things like ibuprofen, Aleve, those type things. PT, physical therapy to increase the mobility around that joint and strengthen the muscles around that joint so you're not wearing it and then hurting it as much. And then, of course, always steroid injections are a favorite too. Another condition that I didn't have a slide for is called tendinitis. And anytime you see that itis, that means inflammation of. So tendinitis is an inflammation of the tendons. And remember, the tendons connect muscle to bone. And you have a sheath that kind of wraps around the muscle, and then that tapers down, and that's what connects to the bone. And anytime you get some irritation with that tendon, that could cause some problems as well. Things like tennis elbow, any kind of repetitive type movement, that will cause tendinitis. So you have to be careful there. And the treatment for tendinitis is just plain rest. You have to just let that joint relax. You don't need to use it, and that's the best way to get it to heal. And again, tendinitis increases with age, just like everything else. All right, the next thing is osteoarthritis, and this is the most common form of arthritis. It commonly occurs in like your hands, your hips, your knees, your neck, your lower back, and it's a chronic thing. Chronic means that it's long-term, it is long-lasting, and it recurs. It's not usually a sudden onset type thing. And basically what happens is the top layer of your cartilage that surrounds your bones just breaks down and wears away. And of course this is going to decrease your flexibility. It's going to decrease your mobility. The bones underneath your cartilage will just start rubbing together. So you're getting bone on bone, and that's going to cause friction, which in turn causes pain, swelling, and redness. And you may actually get bone spurs developing. Bone spurs are just where you have little extra bits of bone that start to grow around that joint, and those can be very annoying and irritating. And when you have osteoarthritis, you can actually hear grating noises in the joint. So like you bend down and you hear this crunchy kind of grating stuff, that's probably osteoarthritis. What are some causes of it? Well, first of all, you normally have enzymatic destruction of your cartilage, and then your body repairs it and replaces it with healthy cartilage. With osteoarthritis, what happens is your destruction is a little bit faster than your repair, and that kind of increases the wear, and so you have less cartilage and you end up getting these problems. Some other possible things that cause, I need to switch slides here, sorry. Some other possible causes of osteoarthritis are overweight. So when you're obese, you're stressing your joints. You just have that much more weight to carry, and that's going to cause stress. And as always, getting older, about the time you hit 40 years old, you're going to start wearing out. Things are just going to start getting agitated and weak and just worn out. Joint injuries, especially related to sports. If you've had some sort of injury, you're more likely to get osteoarthritis. Anything that causes, like right here where we're talking about jobs or stress from job or sports, any kind of repetitive movements in the joints are going to cause arthritis or joint disorders. I know this sounds crazy, but you sit there and you do all this with your little cell phone, you can get a thing now. There's a diagnosis called texting thumb. And basically you're getting arthritis in your thumbs. They also have another one known as cell phone elbow, where you're sitting there and you're talking on the cell phone all the time and you're stressing your elbow joint out. They even have one called Guitar Hero wrist. So if you're into Guitar Hero, you may end up having some wrist issues later on in life. But remember, any kind of repetitive type thing, that's going to cause problems with your joints. There's no single test that diagnoses or diagnosis for osteoarthritis. You can do x-rays and MRIs, and they will definitely show the joint damage and the inflammation. But you just look for the warning signs, the stiffness, the swelling, the tenderness, the crunching, and just noisy joints. Those are all pretty much real clues that you've got arthritis. The treatment for arthritis is, believe it or not, exercise. And you're like, well, you just said it's from overuse. Well, you want to do exercises that are easy on the joints and that are going to strengthen all those muscles around the joints. So things like Tai Chi and yoga, just certain physical therapy type exercises, those are all good. You want to limit things like if you were a jogger, you want to start walking. Just limit the high impact and high stress types of exercises on your joints. Weight control, that's a biggie. Lose weight. You're decreasing the strain on your joints automatically when you lose weight. Rest. If you're overusing a joint, give it a break. Let it have some chill time. Pain relief. You can use drugs or not drugs. Some of the common drugs are things like Tylenol. Tylenol is real good for pain control, but it has no anti-inflammatory action. So it doesn't really do anything except treat the symptom, which is pain. If you take something like Advil, or ibuprofen, which Advil is the brand name for ibuprofen, but ibuprofen and Aleve, things like that, those non-steroidal anti-inflammatory drugs, those are going to have the pain relief and the anti-inflammatory action as well. So those are better. You can also get cortisone injections where they actually inject the cortisone right into the joint. Those are very effective at decreasing the swelling. They decrease the pain, but you can't just go get a cortisone shot every time you start hurting. Too many shots will actually damage the joint, and then of course steroids have the side effect of decreasing the immune response, so you might actually get things that could make it worse. So you have to be careful with your steroid shots. You can always use heat and cold. Heat is going to be good because it's going to relieve the stiffness, and then cold, that doesn't look like cold, cold is good because that's going to relax your muscle spasms. So those two things can kind of help. Then you can have acupuncture. Acupuncture is a form of Chinese medicine where they actually inject little or twist little needles down in certain spots, and it sounds like a bunch of hokey magic to me, but it actually works. It's been proven to work, and insurance companies will cover it now. But they do this stuff, and it's supposed to channel your energy, but I don't know how it works, but it actually works. Then you have over-the-counter stuff like glucosamine and chondroitin, these medications that are supposed to loosen up and relieve the stiffness and pain in your joints. And medically, those have not been proven. My sister has osteoarthritis. She swears by it. Man, I just take a drink every other day of that, and I'm good to go. If I don't get it, everything starts getting swollen and stiff. So I don't know if it's just more effective in certain people than other people, or if it's just like a placebo effect that it really is not doing much, but you just think it is. I'm not sure what the treatment source is there. All right, let's move on. Another one is rheumatoid arthritis. Now, rheumatoid arthritis is different because it is an autoimmune disease. Now, if you have an autoimmune disease, that means that your body fails to recognize your own body as self, and so you start attacking your own body. And in this case, your own body, your own immune system, will start attacking the synovial membranes around your joints. And of course, when it does that, you're going to end up with pain, swelling, and stiffness, just like you had regular or osteoarthritis. This type of arthritis usually is going to occur systemically, which means it's going to be all over your body. It's not going to just be in one joint. One joint may be more affected than others, but it usually is going to occur all over the place. It's really common in middle-aged women. In fact, women are 2 to 3 times more likely to have this than men. Also, it occurs in older people, and I love the way your book put older people as 30 to 50 years old. So I'm a real old person. But as you age, again, this becomes more likely. There is some genetic tendency for that, but that hadn't been shown to be real strong. The treatment, again, is use your anti-inflammatory drugs. You can also take drugs that suppress the immune system. If you turn off that immune response, you turn off that attack on your joints. Again, physical therapy to strengthen your muscles, and especially around the joints. And then also you can have surgery. Surgery is usually warranted when you need the pain relief, or a lot of times you'll see where the joints are just so destroyed that they start getting real knotty looking and disfiguring, and they can actually, your fingers can turn at different angles and stuff like that. So you may need the surgery just to correct the joint deformities or relieve the mobility and just restore joint function with these joints that have been attacked. All right. The next thing is Lyme arthritis, and you've probably heard of Lyme disease. Well, Lyme disease is the most common tick-borne disease in North America and Europe, and it's caused by a bacteria that's actually carried in the ticks, the deer ticks. So if you have a tendency to stay out in the woods or work out in the yard where you have a lot of ticks, you're at risk for getting Lyme disease. Basically what happens is the tick gets onto you, and then the tick starts feeding on your blood, and in that process it's going to inject some of the bacteria into your blood, and then you get the Lyme disease. There's some risk factors that go along with, well, let's look at symptoms, with Lyme disease. The early symptoms you're going to see is you're going to get this characteristic bullseye rash. So if you've got your tick bite right here, you're going to get a rash that's going to start making little red marks that kind of look like a bullseye. And these bullseye rashes can get up to 12 inches in diameter, so they can really get to be big. But that's just like the classic Lyme disease characteristic. But you're also going to have fever and flu-like symptoms, things like aching, stiffness, tired, chills, stuff like that, joint pain. Then as the disease progresses, it can actually turn into much more serious things like meningitis, where you get inflammation of the meninges around your brain and spinal cord, neuropathies, pericarditis, where you get inflammation around the heart. So it can be very serious. And then the last manifestation of it is you get this Lyme arthritis. And Lyme arthritis is different because it's kind of migratory joint pain. So the pain sort of jumps around from one joint to the next, and it just can be very annoying and irritating. The treatment, of course, for Lyme disease is antibiotics, and if you get it early on, you don't even know you've got it practically. You just take a round of antibiotics, usually a minimum of 10 to 14 days. Most people recommend 3 weeks, just to make sure you kill all the bacteria. But if you kill all the bacteria, you're not going to have any problems, and it stops the disease progress. But again, the risks are obviously if you're outside around deer ticks, and also the longer the tick stays on you. So if you have a tick that gets on you and has a long period where you don't realize it's there, so say it's there for 48 or more hours, then you have more chance of getting this Lyme arthritis. So kind of reminds me of that Brad Paisley song, I'd like to check you for ticks. There actually can be some value in that. I'm not going to recommend who you get to check you for ticks, though. All right, another thing that I want to talk about that I don't have a slide for is gout or gouty arthritis. Basically, you probably know it as gout. This is an acute thing, which means it occurs suddenly. In fact, gout can wake you up in the night with just these severe pains. And basically what happens is with gouty arthritis, you get a buildup of uric acid crystals. And your body is normally sends out uric acid through your urine, but if for some reason you're producing too much or not eliminating enough, you get this buildup, and it forms these crystals that are like needles. And these crystals will settle in your joints, and so it basically feels like you've got all these little needles just stabbing your joint. The most common place for gout to kind of settle, those crystals to settle, is your big toe. And I have seen grown men just die, not literally die, but whine and carry on like they're dying with pain with this gout. I've had it before, and I can tell you it hurts. It can be chronic in the sense that it will reoccur. It doesn't always reoccur, but some people just have a tendency towards gout, and so it does kind of get to be in a chronic form. But basically, you get these crystals, they settle in a joint, and you just got to gut it out until you can get them processed. So you drink lots of water. There's all sorts of folk remedies like cherry juice and different things like that that are supposed to help. Diet, though, can be really a big factor in whether or not you get gout. Shrimp are horrible as far as causing gout. Shellfish, asparagus, anchovies, broccoli, anything that's going to increase your uric acid increases your chances of getting gout. So you need to watch your diet. Also, if you drink alcohol, that increases your chances. If you have high blood pressure, diabetes, high cholesterol, all those things can increase your chances of getting gout. It tends to be more common in men than women. And what happens is the estrogen in women actually increases your elimination of uric acid. So that's why men tend to get it more often. And there is sort of a family history that goes along with it as well. But that's one that you don't want to get because it hurts. Okay, so let's finish up with these lifespan changes. Basically, by 2 years old, all of your fontanelles, remember those are the little joints in your cranial bones, those are all closed up at 2. And so those have calcified and they're no longer moving. I should say ossified instead of calcified. Your synchondroses at your growth plates, those are going to ossify. Usually that occurs right after puberty. About the time you hit 40, you start feeling joint stiffness, and what happens is the collagen starts to change in structure as you age, and that just causes pain. So the older you get, the more you ache, the more stiff you are. You try to get out of a car and you realize, man, I've been sitting in one spot too long and I'm stiff. And those are all things that you can look forward to with aging. Basically, you can do something about it, though. Activity and exercise can keep your joints functional longer. So people who say, oh, I hurt, I'm just going to sit around. Well, you're going to hurt more and you're going to sit around more because you're going to stiffen up and you're not going to be able to move. So the thing to do is keep moving, and don't just move like, I'm going to go out and I'm going to play football. No, those are going to be blowing, jarring type joint injuries. You want to do exercises that are going to keep you flexible but yet not strain your joints. So if you were a jogger, you might want to switch to walking or swimming or biking, something that's not so hard on your joints. Physiologically, though, your body just wears out with age. And so all I can say is I hope you age gracefully. All right, that's it for me. Thanks. I can get this thing to turn off.